Heart attacks are the leading cause of death in America, and there's a lot we can do to prevent them, and we can also try and work hard for early detection. Both those factors can do a lot to make the deaths that occur and the number of people that suffer from heart attacks reduce immensely. We know that lifestyle is probably the most important factor that has to do with whether or not you're at risk for a heart attack, because lifestyle factors cause, if you don't pay attention to them, cause inflammation. And inflammation is what sets the stage for that cascade of events that leads to coronary artery problems, plaque formation, clot, and heart attack. So the factors have to do with diet, exercise, stress reduction, sleep, weight control, and of course having as much of a meaningful purpose in life as possible. The risk factors that are most commonly looked at include things like smoking, which we all know greatly increases your risk for a heart attack. Cholesterol is often cited as a cause for heart attack. I don't really look at it that way. I think that heart attacks are associated with people who have abnormal cholesterol values. Whether or not they actually cause the plaque in the artery is up for debate, and it looks like that's probably not the case. There are a lot of associated diseases that we know put you at risk for heart attacks, things like diabetes and hypertension. If your lipids are not normal, we know that's an issue. If your homocysteine or lipoprotein a or iron levels are off, that's also a factor. We know that if your weight is up, losing weight makes a big difference in improving your risk for a heart attack. Same thing with personality type. If you've got anger management problems, you're at risk for a heart attack. There are things that you can do through biofeedback and counseling and imagery that can make a big difference in that. There are some tests that are not done very often in mainstream medicine that I really think are important that we should consider, particularly if you're at an increased risk for heart attacks, if you have some of these factors. Those three tests really include heart rate variability, vascular stiffness, and live blood cell analysis. And they are very predictive. The heart rate variability test is the most predictive test in all of medicine of mortality from all cause as well as from heart attacks. It's an inexpensive test that it is approved by most insurance companies, but very few cardiologists are doing. That heart rate variability test measures the rhythm of the heartbeat. It should vary with respiration, with emotion, with exercise. If it doesn't, then we know it doesn't have the adaptability that it needs to be able to adapt to different conditions that we're in that might lead to warning signs of a heart attack. So when we know we have an abnormal heart rate variability test, it's a red flag that goes up that says there's a problem here, investigate deeper. And that's when we can use our fancy tests that we use, like cardiac echoes and nuclear scans and CT scans and coronary arteriograms. There's clearly a place for that. But these are secondary tests, not first tests. They're not where we start, but it may be where we finish. The other test that's important is a vascular stiffness test, and what this measures is the shape of a finger pulse. If that shape is blunted, it tells you there are blocks in arteries that must be dealt with, and that an additional workup must be done to try and assess the extent of it. Then there are many things that you can do that we'll talk about in a minute to try and reverse that. Another problem that should be, or another test that should be looked at, is the live blood cell analysis, which is where you take a drop of blood from your finger, you put it in under the microscope, and magnify it 10,000 times, and you examine live blood, and you watch it for a day, and you observe whether or not the red cells are sticking together, or the platelets are sticking together, or there's a lot of fibrin there, or there are other signs of toxicity in the bloodstream. If you see that, you know that your risk for having a heart attack or a stroke or some other vascular problem is increased immensely. So this is a very, very useful test. It's not done in the mainstream. God knows why. Some tests just never catch on in the mainstream, but there's a lot of data behind them, and it makes sense. Wouldn't you like to see what your live blood looks like rather than looking at a dead smear that's been stained and altered so that it's not quite as easy to see? Now, what do you do to reverse heart disease? You know, we all know the studies of Dean Ornish. Well known, insurance is reimbursed on that. And most people think that Dean Ornish's work is about a diet, about a high carbohydrate, from complex carbohydrate, but low and simple carbohydrates, a low fat, very low animal fat diet, and a normal amount of protein. And Dean Ornish himself says the factors that make the biggest difference aren't so much those values as they are how you look at yourself in terms of your relationship to the rest of the universe. If you use the words I, me, my, and mine instead of we and us and together and community, that's really the most predictive factor that there is in the Ornish protocol. Still, the whole protocol, which is a complex one that's diet, exercise, stress reduction, yoga, meditation, is a very good one. There are new things that have been out for a few years, things like the amino acid L-arginine, which is the precursor of what? Nitric oxide, which is exactly what's in nitroglycerin, which is what heart patients use when they have this crushing chest pain called angina. And what it does is it takes an artery that's constricted and it pops it open almost instantly. And if it's taken over a long period of time, there's preliminary research that suggests strongly that you can reverse the plaques that are in arteries. So that's an important addition to this protocol that could be used. Similarly, vitamin D3, another thing that helps reverse insulin resistance, is something we should be thinking about. And then all the lifestyle factors that we know about, that we've already mentioned, are critical. Eat real food. Make sure you're not eating a lot of sugar. Avoid high fructose corn syrup. It's what causes the changes that lead to the metabolic syndrome and type 2 diabetes. Fix your stress if you've got it. Work out your problems. Make sure you're getting enough sleep. Your body won't restore itself. Get your weight down the best that you can, and above all, have a meaningful purpose in your life. This disease, heart disease, is the leading killer in the United States. It's a preventable disease almost always. There's a lot you can do about it to both assess it and to go ahead and prevent it from becoming an issue that's going to affect you or one of your loved ones.